Welcome back to Chapter 2, Medical Student Pathologies. For our first topic, we will go over gunnar malignancies. The idea here is that, though we've been talking about complaints our patients may have, it's very likely that your fellow classmates will also have pathological findings. There are a couple of high-yield associations specific to medical students that examiners love to test on. So first, the med student. We can either develop a benign study adenoma or a malignant gunnar carcinoma. The first type of med student pathology we'll cover is the benign study adenoma. Now, I put this picture here to remind you what a classic case of study adenoma will look like. Notice that he's using split screen for his notes on the left and Netflix on the right. He's also currently browsing Facebook or perhaps texting on his phone. Note that his phone is not set to vibrate in the library, a clear sign he's fine with being disturbed while studying. So, study adenoma. This is a benign lesion with no increased risk for cancer. As I stated, it classically presents in a young male, maybe in his early 20s, fooling around with Facebook or Netflix in the library. Now, how will we confirm a diagnosis that this is study adenoma and not full-fledged gunnar carcinoma? We're going to have to do an adrenal biopsy. Under the microscope, an adrenal gland biopsy from a patient with study adenoma will show thyroidization for all three layers of the adrenal cortex. You can easily see the thyroid follicles with its collared material forming a P equals MD appearance. Extremely high yield. P equals MD thyroidization of the adrenal cortex. Moving on to other gunnar malignancies. Now, this is especially high yield because it ties back to neoplasia fundamentals, and examiners like to go after this. Gunnar carcinoma in situ, or GCIS for short, is a benign lesion that has the potential to become malignant. This depends on the study resources the student uses during first year. Usage of first aid shows a 2 times increased risk, and usage of firecracker during M1 shows a 5 times increased risk of gunnar carcinoma. Now let's take a look at a gross specimen of gunnar carcinoma in situ. This image should remind you that they present often in the first year of medical school. First, it's key to recognize that the leaves outside are changing color. Board examiners want to make sure you can make the connection that this gross specimen is taken during the fall season, and thus the first year has just begun. This first year is using first aid and firecracker, most likely in October through November. This is further emphasized by the anatomy scrubs he is wearing. Using first aid and firecracker 2 months into med school is a pathological finding and are some of the strongest risk factors for developing gunnar carcinoma. So, for example, if I ask you what is this risk of gunnar carcinoma in a student using first aid, well, let's say I also tell you it's the fall of the student's first year. The answer would be a 2 times increased risk, and you need to know this. Briefly, let's go over some of the other risk factors for gunnar carcinoma. Aside from study resources, graduating from an Ivy League college, limited social skills, and having a family history of overachieving older siblings can all contribute to developing carcinoma. There's been an observation of increased prevalence in Ashkenazi Jewish populations as well. Now, of course, once patients develop carcinoma in situ, they'll eventually develop invasive gunnar carcinoma. Now, with invasive carcinoma, the key feature is that they'll utilize every resource possible to make sure they know all the high yield points cold. This typically will present during second year after the student returns from winter break. The DSM-5 states that deactivation of social media, for example, Facebook, Instagram, Snapchat, with over 120 days away from the step 1 date is clinically diagnostic of carcinoma. However, during dedicated study period, these symptoms are no longer relevant. Let's take a look at one final gross specimen to get a better understanding. Here we see a second year student overloading with resources. First, you can see him using 2 question banks simultaneously, having both first aid and Golian on the table. Scattered along his desk are pharmacology flashcards, and off to the side you can see him watching some Pathoma videos made by my colleague Dr. Sitar. One key thing to note is that he is watching the dermatology unit. Can you think of a clinical application to this typically physiological finding? Excellent. The student is trying to match into dermatology. also given by his reminder on the wall of 270, referring to his desired USMLE Step 1 score. And that's all we have for gunnar malignancies.